Guys, thanks for listening in. Today I'm going to be talking about medieval doctors in GCSE History, Medicine in Britain. So, there were no professional doctors in medieval times. Different types of people were offered different kinds of treatments to make them better. Medieval doctors usually learned through word of mouth or through personal experience. They experimented with herbs, charms, and learned from apothecaries, who was a person who sold medicines, traveling healers, and wise men or women. Barber surgeons were people who had access to razors and did a lot of medical procedures. Barber surgeons did not get any training. They could cut people's hair, do bloodletting, and even amputate people's arms and legs. However, a lot of people died because their wounds were infected or they lost too much blood. Medieval doctors, these were the closest thing to our view of a modern-day doctor, was a man, and they are a man or a woman who had been trained in the Hippocratic and Galenic methods. So, barber surgeons were people who had access to razors. They could cut people's hair, they could do bloodletting, they were not trained, and they could amputate people's arms and legs. So, we know that there were not professional doctors in medieval times. However, there were medieval doctors, which were the closest thing we know to them now. So, the influence of the church on medieval doctors. The Christian church was influential and popular in Europe in medieval times. Lots of doctors were trained at universities that were set up by the church, and most of these were based in Italy, for example in Bologna and Padua. The church and monasteries generally controlled the education, and Galen's ideas were usually taught in the church's medical school. The Christian church liked Galen's ideas. They thought it fitted with their view of God, and doctors believed that his ideas were correct. Doctors had some tools to treat patients, including a book which recorded the possible illnesses a patient might have, leeches in order to remove blood, aromatic objects which could stop miasma, these were bad smells which were believed to cause disease, and a zodiac chart to predict future illnesses. Most doctors were in large towns, and they were still rare even in these. Doctors were expensive, and most people couldn't afford to see them, and some doctors began to observe and treat their patients on the battlefield in wars, again making them more rare in these towns. The poor could only receive medical treatment in hospitals set up by monasteries. However, lots of people who were very ill were not treated, because people were scared that the disease could spread to other people. Apothecaries were people who sold herbal remedies in medieval times. Female apothecaries were called wise women, and most people couldn't afford to pay doctors or physicians, so they used apothecaries. So we know that female apothecaries were called wise women, as I've just mentioned, and medieval doctors were trained in the methods of both Hippocrates and Galen. So, as we discussed earlier, the barber surgeons who cut hair but were also able to amputate legs and do bloodletting, they found that many people died because their wounds were infected or they lost too much blood. So to recap about the poor, lots of people who were very ill were not treated. This is because people were scared that the disease could spread to other people. So lots of doctors were trained at universities that were set up by the church. Most of these were based in Italy, as I mentioned before, in cities such as Bologna and Padua. Okay, so that's everything I'm going to be talking about today with regards to medieval doctors. Thank you very much for listening.